All right. Good morning, everybody. Welcome to the monthly Southside Wellness Coalition meeting. All right. I think Kim just texted us for the code to get into the Zoom. Have you got that?
Hey, I'm good. I got in. I
Oh,
took.
good. Good. I'm always worried we don't want to miss anybody at these awesome meetings, and people are rolling in from the waiting room. We got folks in the room as well, so this is awesome. Awesome. All right. All right. So welcome everybody. We'll go ahead and get started. For the folks in the room, you've got a copy of the agenda as well as last month's minutes. So we'll go ahead and bring up the agenda first. All right. Here we go. We'll keep an eye on the waiting room. All right. There we go. And also, of course, as you know, the agenda was in the newsletter that went out this morning as well. There we go. Hold on a second. My computer is. Okay, my computer's. There we go. Everybody should see that. Awesome. All right. So monthly meeting, June 18th, beginning at 10 a.m. There's the Zoom link that you all came in on. We're going to do an approval of minutes from the 16th and the 21st. We had the 16th meeting here, and then the May 21st was at the SMVF Summit. Presentation today is going to be on mental health first aid, which I will be providing. Then we're going to go into our recent events and share updates and then talk about what is up and coming. Lots of events and opportunities for our work up and coming, and then move to leadership updates and member updates. And of course, there's a list again of all the upcoming events, our trainings. And the next meeting is going to be July 16th, same time, same place, for July. All right, so I'm going to stop share that. All right. All right, and then we'll go ahead and move around, do introductions in the room, and then we'll do the minutes and move from there. And by the way, folks in the room, you've got copies of various flyers, hard copies. We've got them up here as well. Folks online will share those items, and then if you want hard copies, just please let us know by email or phone call. We'll get those to you as we do have lots of great events coming up. All right, so starting in the room, we'll go around, then we'll jump and popcorn onto the Zoom. So I'm Kenan Tyner-Smith, Director of Prevention at Southside Behavioral Health, Fiscal Agent for the Coalition.
Jenna Dahl, Prevention Specialist for Southside Behavioral Health.
All right, Dennis.
Dennis Hagans, Veterans Affairs and Health.
Awesome. And we're on the awesome owl that's zooming around the room on all three of us. All right, popcorn it onto the, go with the first person I see, Danielle.
Hi, I'm Danielle Lucas. I'm with Tri-County Community Action Agency, and I help lead the infant and maternal health program. Catherine.
Good morning, everybody. This is Catherine Maloney. I'm with Piedmont Senior Resources. I'm part of the leadership team. Good to see everybody here.
We'll go to Elizabeth.
Yes.
Good morning.
Elizabeth Kopp.
Which one?
Oh,
Oh,
Elizabeth Kopp.
yes. That's right. Elizabeth C. We'll do Elizabeth C, then we'll go to
Yes.
B.
Okay, Elizabeth Kopp with Girl Scouts Virginia Skyline. The one county your coalition serves that our council also serves is Halifax County. Great to be on.
Welcome, welcome. And Elizabeth B.
Good morning. I'm Elizabeth Bordelon with Tri-County Community Action. I am the intake specialist. And I will popcorn it to Kimberly.
Hey, good morning, everyone. I am a teacher at Halifax County High School. I teach 11th grade English. And with Jenna's help, we have gotten the Youth Coalition going. So that's kind of my main role, so to speak. Let's see, Amy.
I'm the only Amy, right?
As far as I know, Aim.
Okay. I'm from Virginia Legal Aid Society, and I might need help. I see Jeanette Grimes.
Good morning, everyone. My name is Jeanette Grimes. I'm a community health worker with the Department of Health, and I'm also on the leadership team with Southside Wellness Coalition. And I'll pass it to my wonderful manager, Brenna Link.
Good morning, Brenna Link, Population Health Manager for Pennsylvania, Danville, and Southside Health Districts. And I will pass it off to Brian.
Good morning, everyone. Brian Price from the Virginia Rural Health Association. And who's left?
Deanna, welcome.
Hey there, I'm Deanna Lester. I'm a critical care paramedic, new to the group, and founder of Southside Child Advocacy Network, or SCAN. We're a new nonprofit focused on child safety education, family advocacy, connecting families with resources across Southside Virginia. I'm excited to be here and to learn more about the coalition. Thank you.
Morning, welcome. Allison?
Hey everybody, I'm Allison Byrne. I'm the Community Engagement and Partnership Coordinator at the Richmond, Virginia VA Medical Center. And I do outreach work around suicide prevention, specifically veterans, family members, and active service members. Glad to be here. Thanks.
Awesome, welcome. Chief?
Good morning, everyone. Alfonso Ozzel, Chief of Police here at Southside Virginia Community College. And I wanted to take a second to thank the coalition and everyone for the Veterans Mental Health Summit. As a veteran, that meant a lot to me. So thank you guys. That was a lot of good work that went into that. Thank you.
Thank you. Yeah, lots of folks on the call were wonderful and supportive of that. And we'll go ahead and make it a little quick announcement now about that then, since you brought it up. It was a fantastic event, very well received, and we've already received information that we are up for another mini grant through our region to host it again next year. So super excited about that. We're going to see how we can make it better. Get in touch with more local SMVF and families. But yeah, we've already received notification that we're up for, hasn't been finalized, but we're up for to receive more funding next year. So thank you, Chief. I think, let me double check. Oh, Khadijah's on. Good morning.
Good morning. My name is Kadisha McCargo, and I am the coordinator for the Mentor Role Model Program at Tri-County Community Action Agency.
Morning. And Shelley.
Good morning. My name is Shelley Morton, and I'm the Senior Reentry PO for South Boston Probation and Parole.
Welcome. All right. I don't think I missed anybody that you see, Jenna. No, I think we're good. All right. Awesome. All right. So glad so many folks are on here this morning. Welcome. Glad to be here with you. Glad to talk about recent wins and again, all the great work we have up and coming as well. So let's move quickly to the minutes from the last meeting. Go ahead and roll that up for us. All right. And again, those of you in the room have a copy, and those online, I'm sharing that now. Let's see, there we go. So back in April, I'm going to scroll through that. Seems such a long time away, doesn't it? Things move fast. All right. Awesome. Back in April, I'm going to scroll through. Presentations by Billy Joe Wilkinson from Liquid Life and Catherine Wilson, Lock and Talk. Speak updates. Lots of fantastic member updates. All right, awesome. Certainly talked about the Infant Maternal Health Summit that was hosted on April 18th. All right, and of course, encouragement to attend upcoming events. was adjourned. And then, of course, at the bottom of that, reminder that we would be hosting on the day of our May meeting, the SMVF Summit at the Prizery, which you can see there at the bottom of the minutes. Just take a special note for me to notice that it says there, took place at the Prizery where 7 members from the coalition volunteered. We had a total of 114 people attend, which was higher than the previous year. 29 volunteers, coalition members, staff, and peer support specialists, 20 local youth from our junior ROTC program at Halifax High School, 13 speakers and panel members, 26 different area agencies that were there to showcase their services and share great information about themselves, and which most of you, I believe, are on the call here today. So thank you so much for that support. 26 folks we called attendees, meaning that they didn't have a particular table or, you know what I mean? They walked in and enjoyed the day just as we did, but didn't have a particular assignment or support. Was 26 folks, 7 who came walking in the door that morning, which is fantastic, and 19 pre-registered. And a special shout out to Elena Martin, who was our master of ceremonies throughout the day with Southside Behavioral Health Buck Buchanan, who's a veteran. They did a phenomenal job to present the day. So again, while I'm scrolling up and down, need a motion to approve. Of course, first of all, any questions about the minutes?
This is Catherine. I'll motion to approve both sets of minutes.
Awesome. Thank you.
Do I have a second?
I'll second again, just like the other.
Awesome. Dennis does a second in the room. Awesome. Fantastic. All right. So going back to, before we move into talking again about the SMVF Mental Health Summit and the upcoming Infant and Maternal Health, the Infant and Maternal Health Summit we also had in May, not May, excuse me, in Mecklenburg in early June, and upcoming events. I'm going to do a brief presentation on mental health first aid. So let me share that. So for those of you in the room, you have copies of all the upcoming classes that we are hosting in the community. We've got 6 at VCU CMH, the Community Memorial Hospital in South Hill, and we've got classes coming up between July and November at the Southern Virginia Higher Education Center in South Boston. Again, the idea to provide these classes across the 3-county area with 2 major locations where they have large classrooms, good technology, bathrooms, and close places to get lunch, because we only break for about 45 minutes to an hour for lunch. But wanted to spend some time piggybacking on Mental Health Awareness Month. Of course, if you do not know, what is mental health first aid? Right, and I'm going to bring up, there we go. I'm going to try to, here we go. There we go. And everybody should see a Southside Behavioral Health Facebook page. And again, I'm going to utilize this as something to show and talk about this particular class. So as you all know, as our prevention team, part of what we are tasked to do is to provide classes around mental health wellness and suicide prevention, overdose prevention across the community. And one of the classes that we provide is called Mental Health First Aid. And I'm going to bring you there so if you go to our website under prevention, which I'm going to right now, so your screen should change and show a quick picture from CADCA many years ago. And when you go to prevention and you scroll down to under suicide prevention trainings, there's a link for a class that we offer called Mental Health First Aid. So your screen should be changing to a description of that. And of course, what that is a class that's internationally recognized and definitely recognized by the state of Virginia as well as the federal government for being a best practice class for folks to take in the community And when I say in the community, it can be taken by anyone. You don't have to have any specialized background, any type of additional education. It's around teaching folks the soft skills about how to respond to someone who you believe is struggling. And so the class is what we call blended or virtual, meaning that we can offer the class 100% virtual. You'll go online and spend 8 hours with two trainers on a platform like Zoom and learn all the skills around recognizing early signs and symptoms where someone is struggling, worsening signs and symptoms of someone struggling,
Uh-huh.
and then going
Is
into
she?
how to respond when they're in crisis. And through the course of the day, we could look at case studies. We do a lot of small group activities. Folks get an opportunity to talk about best practices when it comes to language and body language. We watch a number of different videos. So it's not just the trainer's two voices, but also videos that go into different possible scenarios. And again, lots of opportunity to talk and work together. We provide drinks, we provide snacks, make people feel welcome and comfortable. As again, sometimes the topics can be tender to folks' hearts. So that class, again, as I just said, can be offered 100% virtual, which we did many times during COVID. Since COVID, we've moved toward doing a blended version. And what that means is that the class, you do 2 hours online ahead of time. So now I'm switching the screen to the actual company that we actually have a contract with. So again, mental health first aid is not a class that I created from Google or ChatGTP. This is a internationally recognized company that we have a contract with. And because we have certified trainers such as myself who teach for the company, we're able to provide the class again at no cost to the community, any community member in our 3-county area. You can see by there, this is our website. This is our website that, again, gives you information about the classes and the classes that we have. And again, I'm just scrolling down again just to help you guys see where all this stuff is. Free 8-hour course. So as I was saying, the blended class is 2 hours online where you go online and do 2 hours of pre-course work. It introduces you to what the class is about. You watch a few videos and then you come to the 6.5 hour. And again, there's an hour for lunch. So it's 6.5 hours. And either right now, we're having a number of those classes at VCU Hospital in the coming months and also hosting them at the Southern Virginia Higher Education Center, where you would spend 6.5 hours with myself and another team member, again, doing a deep dive into case studies, watching videos, having small group discussions around learning the action plan around how to connect someone who you believe is struggling either with early signs and symptoms of a struggle or worsening signs and symptoms, or if you believe they're actually in crisis, how to connect them to local resources, whether it's to Southside Behavioral Health's emergency responding team, or to another local agency, or to a local hospital, or also the 24-hour, which is the 988 Suicide Crisis Lifeline. So again, it gives you the opportunity to learn all the various skills around identifying folks, the language around talking to folks, and then also what are our local resources. And then as a group, we talk. I mean, we have a lot of really good, frank discussions about what is lacking in the community, gaps in the community, and sort of share with each other and develop different resource guides. And then afterwards, certainly after having met my team, especially if they haven't met us, allowing us to develop a good quality relationship with that person in addition to all the connections they have. And as you all know, then have events and share resources and brochures and magnets, things that we can give folks to help them feel comfortable to connect their loved ones, the folks that they connect to every day, to good quality resources in the community and not just us, right? But to give them that good quality education, right? People do better when they know more and have additional information about what's available. So again, showing here now on the screen is our website, which then there at the bottom tells you that you can click here to view for register for upcoming trainings. So this is a link that we have in addition to our flyers that are on social media, Facebook and Instagram. You can click here. It will take you to our online link that comes directly to all of our mailboxes so that we can reach out to folks and say, great, we're so glad you registered, and get them enrolled in the class, get them moving on their pre-coursework. So for example, we are getting ready to host on July 9th, which we still have open seats, by the way. On July 9th is our next class at VCU Community Memorial Hospital. We are actively registering folks now and getting them through their pre-coursework, getting them onto the online portal, and reminding them to meet us at 9 a.m. on July 9th at VCU Hospital in the Care Building in room 111. Oh no, it's like 1113. And then, of course, just to mention, also in July, our second class we're hosting on July 24th, which is a Friday. Sometimes Fridays are better for folks. We're hosting, again, that same class at the Southern Virginia Higher Education Center. And again, we just launched that class this past Monday. Again, sometimes people like to have 2 to 3 weeks, when they have time to go on a portal and do some online pre-coursework. And again, we'll be touching base with them, reminding them to meet us at the Southern Virginia Higher Education Center on that Friday morning. So on this website, so I wanted to share a little bit about that portal. So here at the bottom of our page that we have at our agency about mental health first aid training, if you click here, this takes you to the website of the company, as I mentioned earlier, that governs. It's called the National Council of Mental Well-Being, National Council for Mental Well-Being. They own, they govern, they research, they gather data, they evaluate trainers. This is the organization that is the powerhouse behind the classes that we teach. And you can see here that, again, it goes into the importance of creating and providing skills to local folks around supporting folks who may be struggling. And of course, for our team, just to let you know as I scroll through, so our team has the ability to provide adult mental health first aid. That means that when we teach the class, we're specifically talking about those ages 18 to roughly about 65. There are some commonalities about how it's good to talk to folks in that age group about what they may be struggling with and how to connect them to resources. We also have a class that we can teach called Youth Mental Health First Aid. So you'll see on our flyers and our website that, again, those classes that we're teaching at the hospital and SVHEC, some are adult and some are youth. With the youth class, that is teaching adults, not youth, teaching adults about how to support youth. And again, with the idea that they're between the ages of 12 and 13 to 18, right? And we do case studies with young people. We talk about what's the best language to use with young people, and we have that class. And then the third offering that we have is older adult mental health first aid. Because we know that population, along with other populations in our community, are at higher risk for suicidal ideations. We teach a class called Older Adult Mental Health First Aid, where again we focus on the population of 65 to however long someone might live, right? And again, talk about common traits of that population, best ways to have conversations. Again, we do case studies looking at some scenarios where we have been talking to someone in the older population, and again, how to connect them to resources appropriately. And that's currently the offerings that we have connected to that. All right. All right. Let me stop my share and open the floor for questions. So I just wanted to do again, go over a little bit of information so that when you start seeing us sharing and encouraging folks all across the 3-county area to attend, if they haven't already attended one of these classes that's being offered between the hospital and Southern Virginia Higher Education Center, that you know what they are. Again, they're real easy links to get to. My team is happy to support you in that if you have any questions. And ultimately, as you all know, with everything else we provide, the class is at no cost. The class is at no cost. And when people release for lunch, we give them a map of the closest area lunches, places that offer lunch in less than an hour. And we do provide water and snacks throughout the morning and the breaks to make sure people feel comfortable. And we encourage them to dress comfortably. You don't have to dress up for the class. And you can certainly bring, a lot of people bring extra snacks. People bring their big Stanley cups. We encourage people to be comfortable so that they're open to these really important conversations and get to meet each other. And I can tell you that we sometimes do host these classes closed to the community for specific businesses and organizations, which we're certainly happy to do for a group of people that are specifically from a church or for specifically from a bank or specifically from another form of industry. We can do that. But we also can share with these open classes in the community. It's also very beneficial when a class has got in it, you know, nurses from the hospital and teachers from a local school system and folks from a local bank and folks from a local industry and a couple of grandparents. You can find that it's oftentimes a very rewarding conversation to talk to each other from different silos about the ways in which you're supporting and making other folks know that it's okay not to be okay, and you can reach out to professional resources. So there's definitely a value in that mix up of folks from all different graphics and age groups to come together and have a good, important conversations. All right, so I've taken a little bit of time there from y'all today with that, but I think that's good, important information. Any questions about the course itself or about how we do that? The floor is open. Danielle said, I enjoyed attending the classes and met dualists, school staff, security officers. Yeah, absolutely. Thank you, Danielle. Yeah, you get to network, right? You get to network and share, you know, with other folks. And then we also find out that no matter where we work, right? No matter where we live, work, or pray, there are folks who are struggling. There are folks who are struggling. And the more that we work together to get them connected to resources, you know, the safer they are and we lose less folks. So yeah, you definitely, no matter who you meet, everyone knows someone who's struggling or has struggled or who unfortunately has lost someone to suicide. Any other comments or questions? All right. Well, the floor is open to talk about again, as the chief brought up earlier. We had grand success with the service members, veterans, and their families mental health summit back on May 21st. On our website, Jenna, help me out. I know we had such a tremendous response to that. I think it's on our website, the link. I know it was in the last newsletter where we shared the pictures and all the fantastic stuff that was available. Let me see if I can find it real quick just to brag for a second of how gorgeous you guys look that day. I know it's there. I don't know if it's up yet or not, to be honest with you. It was such a great event. I don't see the link. Oops, I don't see it yet. My apologies. I shouldn't have said that. It's being worked on, but it's fantastic. I don't know if it's been launched publicly, but fantastic event. As I said, lots of great feedback. Anyone else want to make any comments or even make suggestions for next year? All right. Okay. All right. We'll move past that. All right. The next fantastic event we had was that first weekend in June. Again, we hosted the Infant and Maternal Health Summit at the Estes Center. Nice turnout there. Danielle, can you give us an update? I know the other day you shared all the great outreach that was done even after that event. So please share with us this morning.
The highlight, I believe, was Senator Tammy Mulkey, and she did a Facebook Live with the help of your staff. It's been viewed over 1,700 times. So she did a walkthrough and stopped at every resource table and explained the resources. That's on her personal Facebook page. She's also reached out to me and suggested the name of a couple other senators we should connect with who are really supportive of maternal health and So that's great. Some of the networking was excellent. For the families that were there, we've supplied extra services like beyond the summit, with clothing, connecting to doulas, connecting to childbirth classes, all sorts of different things that they were in need of. So it's been good. We received, I think we're helping another 9 families from Mecklenburg County, 2 from Charlotte County from that day.
Awesome, awesome. Yes, very well organized. I think it was a gorgeous day. Anyone else on the call that was there want to share any thoughts?
This is Catherine. I did a chair yoga, quick 15-20 minute presentation that I was pleasantly surprised. Even most of the vendors in the room were sitting there. Got to do a little meditation and some easy movement. So it was good to see everybody there.
I have Catherine's flyers from that day. She gave like a resource to hand out. So I've looked at that. That's a really good one, Catherine. Thank you so much.
My pleasure.
All right, awesome, awesome. All right, so with piggybacking on that, let's talk about the next Infant and Maternal Health Summit, which is going to be August 1st in Brunswick at the Brunswick Conference Center. Those of you in the room, there are flyers. Here we go. If you want to take a few extras with you, you're welcome to. For posting, do this. I'm going to hand those to you. And again, those of you online, if you'd like us, it was in the newsletter, but if you'd like some hard copies or email you the digital flyer, just let me know. Let me share that on my screen. Please, where did it go? Hang on one second. Where did it go? Get the, okay. Here we go. Infant and Maternal Health Summit. There we go. Let me get that up on the screen. Come on, there it goes. There we go. Thank you for your patience as I fly around Zoom. There we go. All right. There. All right, on your screen. Awesome. So our Infant and Maternal Health Summit, August 1st, Brunswick County Conference Center. We did change the time a little bit. You know, with every event, when we debrief, and Danielle could speak to this as well, as we go from event to an event, especially when they've got some common characteristics, we're talking and getting feedback from those who attend about and times and setups and such. And so we did move the time for families further back in the day, start a little bit later in the day, and also talking to our presenters about engagement with the folks who are attending. So we modified that a little bit for the day. All right, awesome. As you can see there, why is AI? I'll tell you this. Sorry. AI is trying to hijack me and my flyer. There we go. All right, I hope you guys can see that. All right, awesome. August 1st. And again, I know Danielle's reaching out to folks, my team as well as others reaching out to folks. If you're not yet on the list to attend this, please let us know, reach out. We have plenty of space. Want as many, again, supporters, local resources to attend this event for families in Brunswick County, just as we did in Halifax and Mecklenburg. All right, awesome. Any questions, comments about that event?
I have one comment. We have a new coalition member who's on this call today. Her name is Deanna Lester with that Southside Child Advocacy Network. And she'll be setting up a table maybe, but she'll be doing a quick, and Kenan, I hadn't had a chance to talk to you or your team about it, but she's going to do one of the breakout sessions or just speak in front of the group at that time.
Awesome. That's fantastic news. Wonderful, wonderful. And Deanna, did you want to talk for a few minutes this morning? I'm sorry to put you on the spot. If you don't want to, tell folks here gathered a little bit about your work and what you are developing with the Advocacy Center.
Wait. Um, we're in our early stages and just getting started building, but we're really focused on prevention through education, and we want to complement other agencies in our area and work closely with them so that we're not repeating services. Um, so we're excited to learn and to get to know everybody. Thank y'all.
Awesome, awesome. And what I'll do is I'll have our team reach out to you to see if in the coming months, if you would like to do a presentation similar to what I did at the beginning. We oftentimes have folks that would like to come on and talk a little bit about have a slideshow presentation, and share more information. And again, we'll follow up with you and see what month might fit your schedule in the coming months to do that for us.
Absolutely. I'd love to. Thank you.
Awesome. Thank you. And a reminder, that's an open invitation to anybody on the call as well. We're changing up a little bit. Yeah. We're changing the order of the things on the agenda. Yeah. Always making improvements. All right, awesome. So then, so up on the agenda as well. So coffee and commerce. So as many of you know, we had a coffee and commerce event with the Halifax County Chamber at Recovering Hands in Nathalie on June 16th from 8 to 10 a.m. where there was coffee and treats and lots of good conversations with folks from various agencies, including Tri-County Community Action, the Coalition, Southside Behavioral Health, and of course I can't name, but there were lots of partners there just to support the activities and the growth of Recovering Hands in Nathalie for local females who need access to good quality care as they're recovering from a substance use disorder. We team members got a tour of the facility and again got to network with other folks. So it was a great opportunity to get a chance to visit that beautiful place in Nathalie, and of course, and also see the new buildings they've recently built as part of that care for local women in our community. And then up and coming, in addition to the Infant and Maternal Health Summit, we are going to be having a Revive. So we are going to be hosting a Revive opioid overdose training at Recovering Hands on July 10th. And then we've got Safe Talk coming up. Again, flyers in the room. And for those of you online, that'll be on social media, and you can email me for digital copies. We're going to be hosting a Safe Talk, which is a 3.5-hour suicide prevention class that we provide. The YMCA is hosting that on August. Dennis, tell me the date. Is it the 11th or the 14th? I got it ahead of 11.
From 11 to 2:30.
Yeah, it's 11 to 2:30, and lunch is provided at the Mecklenburg-Clarksville YMCA. Would join us there. And the class is during that time because we've talked to the YMCA and they have actually quite a few local folks who attend their exercise morning classes that start around 8 o'clock or 9 o'clock, and a lot of them end around 11 o'clock. So we're hoping to capture those folks with pre-registration and also maybe capture folks as they're leaving with their yoga mats to come out of the Y at 11 o'clock and circle them right back in with lunch and a class about suicide prevention, because who doesn't have 3.5 hours, really? Who doesn't have 3.5 hours to have a good quality conversation about supporting other folks that may be struggling and connecting them to resources? And then let's see, and then Revive, also flyers in the room, and again, they'll be on social media. And again, I can email them out to folks. Just to remind you that Tuesday was our lunch and learn every month for an hour at lunchtime, 12 to 1. You come online virtually, so it's 100% virtual, so you can eat your lunch at your desk. And we do the Revive class in an hour. And again, my team delivers folks Narcan and the kit afterwards. We just finished our June class this past Tuesday, and now are announcing the Lunch and Learn for the rest of the year. So on the flyer is the rest of the Lunch and Learns that are available. And let me get that up there on the screen to show you again the flyers that we're talking about. The Lunch and Learn. Let's see. Here it is. Lunch and Learn Revive. And also the Safe Talk at the YMCA. Come on. Oh, there it goes. There it goes. I got it. Okay. All right. Where did they go? Oh, there they are. Okay. Oops. Hold on. There it goes. There we go. There's the Revive class. Again, to encourage folks to be trained to use Narcan in the event of an overdose. Those are the 6 classes for the remaining of the year. Again, to encourage yourself, your neighbors, your friends, coworkers. You can register right now for December 2nd. If you want to wait until around the holidays, there's a class available again. And my team delivers all your Narcan and kit to you within 48 hours after the class ends on that particular morning. Right? Oh, you want to look at something? Yeah. Yeah, July, then there's August, September, October, November, and then December, all from 12 to 1. And again, we just had June's 2 days ago.
Will you send a copy of that flyer? We can get that out at the farmers markets and stuff.
Oh, that would be nice.
It
Yes.
goes in all of my follow-up meetings. It'll be in that every single month.
Yeah, so Jenna, when Jenna sends out the follow-up email to everybody who attended today, she also sends all these flyers, right?
Yep.
Yep. All right. I just want to show y'all what they look like. So we sort of, remove that. What does it look like? What am I expecting to get? And here's the other one too. For Safe Talk, close all tabs. My Zoom is moving slow today. It's just trying my patience, y'all. I'm just taking deep breaths. Where did the Safe Talk go? There it is. Safe Talk at the YMCA. Again, lunch provided with this one. Again, if you know folks that, oops, don't do that to me. Acrobat's trying to mess with me. Here we go. Share screen. Thank you all for your patience. There we go. So on August, again, and this you should see this on the YMCA social media as well as ours. And again, the flyer will be going out with Jen and her follow-up. August the 11th from 11 to 2:30. Safe Talk, real quickly. You might be thinking, how is this different from mental health first aid? The class I talked about earlier. Well, mental health first aid with your 2-hour pre-coursework and 6.5 hours in person, that does a whole deep dive into talking about mental health wellness from generalized anxiety all the way to schizophrenia. And we go into different action plans about worsening early signs and symptoms, worsening signs and symptoms, and an action plan. And how to support folks in crisis. Safe Talk is governed by a different company called LivingWorks, which is actually out of Canada. It's also a widely respected, well-recognized company. Again, the federal government supports that company as well. The difference really is Safe Talk is 3.5 hours. We don't spend time talking about early signs and symptoms and worsening signs and symptoms. We go right into the idea that anytime someone is struggling, you should consider suicide's a possibility. And we do videos, we do one case study, we do some practice, but it's a more condensed version. A very good class, just as effective. You might be wondering, why do we offer classes about the same topic in different formats? Because we're trying to meet people where they are in terms of their time they have, what their agency prioritizes, And sometimes for some folks, 3.5 hours is a better match than for the longer 8 hour. But they're both good quality classes, and and again, we have certified trainers in both of them. All right, and I'll stop share that. All right. All right. All right. Did you want to do any updates on Hidden in Plain Sight before I open up to the? Okay. Awesome. All right. So that's what we have. So the floor is open. We can start with any leadership team member that would like to make an update, and then we'll move to members.
Kenan, hi everybody, Jeanette. With the August 1st event here in Brunswick, there's also another big event that day, now at the same time. But we're going to work with, well, the mayor and I had already talked about working with the organizers of the other event to see if our families could go into that event earlier and then come to the event at the conference center. So we won't have to split participants in two different places over the county. So we are working with that with the two daycares here and the program that Mayor LaWanda supervises.
Okay, awesome, awesome. That's great news. Thank you. Yes. And she shared the other day she was going to do the welcome for us. Awesome.
Yes, great.
Awesome, great. Thank you. Thank you. I appreciate your help with that. That often happens. Often happens. We have events at the same time as other events. Well, at least that's good work though, happening in the communities though. Good work. All right. Anyone else from leadership team? Or we'll open the floor to members. Any announcements you'd like to make? Anything you'd like for us to share? All right, Dennis. All right, we'll start with Dennis in the room.
Yep, we had our fishing event yesterday for the disabled veterans from Durham and Richmond VAs. We also had a number of veterans show up.
Kenan, can he speak louder, please?
Oh,
okay. Is that better, Catherine?
Come on, Dennis, you can do it.
He needs to sit a little bit closer. I keep telling him we won't bite him.
I like sitting in the back of the room.
He does like to be in the back. I promise y'all, we have seats right up at the front.
We yesterday had a fishing event for disabled veterans. We had numbers of veterans from both Durham VAs, Richmond VAs, Granville County, Vance County, and of course, we had our locals. We had over 30 veterans that came down. We also had over 15 volunteers. We had over 6 boats worth of fishing. We had numbers of whether it was bass or catfish caught. Everybody had a good time. The next event will be September 16th for Vets on a Roll.
Okay.
It will be a fishing pond, but it's our annual fish fry. So people are always welcome. We'd love to have more veterans and all attend. In fact, I just heard from the Southern Virginia Community College that there's a young man there that attended.
Oh, nice.
Please, y'all are all welcome. If you know of other vets, the fishing event is free. Everything is free. We have already set it up with the Coast Guard and Virginia Fisheries and the rest that there's no licenses needed. We had over 6 boats. We had 3 wheelchairs and 4 in walkers. So we have boats that have been modified for depending upon any of your abilities. We also have had more than a few times those that are visually challenged, to include a couple of veterans that are completely blind. And we do everything to assist them. We had a young blind lady that caught her first fish ever, was absolutely thrilled to death. So again, these are things that allow people to be themselves. All you have to do is be a veteran. You can either be a volunteer or a participant. So just please attend if you can.
Awesome, awesome. Fantastic. Thank you so much for sharing that. Thank you so much for sharing that. Awesome. And to piggyback on that, to say that our team missed that event yesterday, but I have to tell you where the three of us were. So I know, no, but I want to tell you no. So yesterday was the Southern Virginia Problem Gambling Conference in Danville Pitt,
And
which
all needed to attend.
no. I had to speak. I had to speak. I had to speak.
Yeah.
Yeah, I did. I spoke. It was fun. It was fun. And then Jenna had to be there for as a vendor table, and Lacey, the Southside Virginia Community College, as the chief can share with you, Southside Virginia Community College hosted their professional development day. So we were invited to revive train their folks at their PD day. And Lacey went to back up Amanda Hutchins, who's not currently on the call, but joined Amanda. So isn't that cool that we're doing all this work and we're all in different places? I love it. I love it.
I mean, that's what it's all about.
That's right. All right. Oh, and Danielle said Youth and Family Services will be at the South Boston Farmers Market next Wednesday. Awesome. Awesome. Yep, we're splitting up. We're splitting up everybody in different directions. All right, other announcements from members. All kinds of great work you guys are doing.
Yes, also happening on August 1st over in Mecklenburg County. Tri-County is doing their 4th annual Rock the Block, where we will have items available for families. Everything is, I don't want to say everything, but the items for the families are free. There are going to be raffle tickets. Those will be $2 a piece, or an arm length for $5. Otherwise, the giveaways are free. We are looking for more artisan vendors and more community vendors. So if you know anyone that may be interested, please shoot me an email so I can reach out to them. And also we're looking for donations for school supplies as well, because this is going to be a back to school event. So any coordination with that, I would greatly appreciate.
Awesome, awesome. And do we have somebody from our team going to that yet?
We talked to them about that.
Yeah, okay. Elizabeth, I'm going to follow up. I know that our team is going to be helping to run the Infant Maternal Health Summit.
Yeah, absolutely. Yes, ma'am. And it's at the pavilion in Chase City from 10 to 3. And we are aware that there will be people at other events as well. So any support that we can get is totally understandable.
Yeah, and we're working with someone from our team from another department that's going to come to that event, and I will follow up with you on that.
Thank you so much.
We're trying to spread ourselves out.
I just put the flyer for Rock the Block in the chat.
Thank you, Danielle.
Awesome.
You're welcome.
Thank you. And that's been shared on our social media already. That's being promoted along with the Infant Maternal Health, the Rock the Block you should see on Southside Behavioral Health, and the Coalition social media too.
Appreciate that.
Awesome. All right, other announcements? All right. All right, if there are no other announcements, we will move to adjourn the meeting at 10:55. We appreciate your time here today. Again, please be on the lookout for Jenna's follow-up email with flyers and information from today's meeting. We will also have the recording in the next email that comes out the Monday before the next meeting. Our next meeting will be July 16th, and it will come out that on the July 12th will be the monthly newsletter that comes out. If you're not getting the newsletter, please let us know. Now, Jenna does send the link to sign up for that to you after each meeting. Also, be on the lookout for any additional information about additional events. I know that National Night Out is coming up soon. I know our team is already currently talking to the local police departments and sheriff's departments about the details around National Night Out. As soon as we have them, we will share them. And again, we're looking for all of us to come out and work together on National Night Out, which I believe is August 4th. So we don't have yet information from all agencies yet. Once we do, we'll start having that. We'll definitely have that by our next meeting. All right. Y'all have a wonderful day. Have a wonderful holiday. Y'all be good.
Thanks, everyone.
Bye-bye.
Thanks.
Hey, Allison. Can you? Oh, she left.
Oh,
Oh, wait, Allison, can you stay for a second?
Stop the recording. Yeah.